Hi, this is Dr. Kurt Woeller for Autism Recovery System. We're going to talk about Dr. Woeller's 4 pillars of biomedical intervention for autism. So there's a lot to think about with regards to biomedical intervention. There are different ways of assessing individuals with autism, but when it comes to the biomedical intervention, really what we're focusing on are underlying medical issues, oftentimes termed comorbid conditions. And this comes down to things like gut problems and allergies and food sensitivity. So there can be a lot of signs and symptoms of this, and lab testing is very important. And I've talked about this in other videos. Dietary intervention is part of my 4-pillar approach: foundational supplements, essential fatty acids, multivitamins, etc. I'll address this shortly here. Digestive system interventions for bacteria and yeast are huge, and then something called methylation, which is a very important biochemical system in the body, which I'll talk about here shortly as well. So diet, supplements, gut treatment, methylation make up my 4 pillars. Now that doesn't mean that's the only thing that's helpful for autism intervention, but when it comes to a biomedical program, if those 4 things are not addressed, if somebody skips over one of those pillars, they usually don't get very far with regards to the beneficial approaches in helping an autistic individual improve their health and overall condition. So in the autismrecoverysystem.com website, there's a tremendous amount of educational information available. There's the 6-module Autism Recovery 101 course. This is a specific course developed for parents or caregivers with an individual with autism. There are videos, there are lecture modules, there are handouts, there's a private forum for ongoing questions and answers, there are Q&A sessions, which is an opportunity for people to ask ongoing questions of me through a live webinar format. There are educational videos, there are case studies, and a number of other things available through the website. So let's focus just on what is autism. I mean, the American Psychiatric Association has rigid criteria that defines this autistic condition. And it really is broken down into 3 major categories: social problems, communications, and then behavioral issues. So, I mean, you can read this slide just as well as I can. There are different types of identifiers that will place an individual on the spectrum if one or more of these types of things shows up. But the problem is these comorbid conditions. These things are not part of the diagnostic criteria, but they greatly impact the overall health of an individual with autism, as I mentioned before. Digestive problems, allergies, infections, food sensitivities, and even an increased risk for seizure disorders as well. And really, this is just a partial list. I mean, there are a lot of other things going on that sometimes need to be addressed. But for so many individuals, their digestive system plays a significant role because the gut either becomes inflamed, or they've got an overgrowth of bacteria or yeast that produce different types of toxins that affect the brain and nervous system. And these things can contribute to many of the cognitive, language, socialization, and oftentimes behavioral problems that are seen. So just like in other types of individuals, neurotypical individuals, for example, colitis, reflux, gastritis, constipation is a big problem. And even these overgrowth syndromes, as I mentioned, like bacteria and candida problems, can be. So when we think about pillars, the first pillar we have to start with is diet. You're just not going to get very far if you don't address diet in trying to address some of the underlying dietary problems that are happening with people, whether it's a gluten casein-free diet or a specific carbohydrate diet, or just improving the quality of diet is critical. So it really is the first place to start. Not every individual gets the same response to dietary intervention, but it's a critical part of this program. It can't be skipped. There have been many different studies over the years that have looked at the increased risk or rate of food sensitivities and other chemical reactions in autism. This was just one example that came out in 2000 out of the University of Florida, where they looked at a higher rate of immune reaction or adverse immune reactions to gluten and dairy, not only in autism, but in schizophrenia too. And then these gluten casein peptides, these chemicals that oftentimes these foods have, which have a drug-like effect on the nervous system, which leads to many of the behavioral and socialization issues that are. So diet is huge. The second pillar is nutritional supplements. I mean, the reality is that supplement support is essential. Many individuals with autism tend to have self-limited diets, so they're not eating a lot of different types of foods. Many of them are driven towards the dairy and the wheat, which doesn't give all the nutrients that are often needed. So there's just a lot of research out there that shows that vitamin deficiencies can be quite significant with individuals with autism. So the implementation of supplements, what I call filling in the holes nutritionally, is very important. The third pillar is identifying toxicity occurring in the digestive system. I've talked in other videos about the complex nature of Candida, which is a yeast, and the byproducts that yeast produces through its own metabolism, one of them being alcohol or ethanol. And this has actually been observed in a number of people who have alcohol-related behavior, goofiness, giddiness, silliness, that is often improved when their underlying Candida problem is treated. But it's not just Candida. Bacterial toxins are also prevalent as well. Now, we know a lot about Clostridia bacteria causing the inflammatory bowel problems or diarrhea in susceptible individuals, but there are other toxins bacteria produce as well. And these toxins can interfere with different types of brain and nervous system neurotransmitters, affecting things like dopamine and norepinephrine, which can lead to a lot of the behavioral issues and cognitive challenges that are often seen. This is a huge area, and why I often advocate that people do organic acid testing, specifically from Great Plains Laboratory, to identify toxins, because there is a relationship between the gut and the brain in how these two organ systems interact, and those affect attention, focusing, etc. The fourth pillar, as far as my four-pillar approach, is the methylation cycle. Now, this video can't go into this in depth. This is a huge topic. But the reality is that methylation problems will lead to awareness issues, language problems, poor eye contact, immune issues, neurochemical problems, even the ability to detoxify the body of toxins effectively as well. I commonly see diminished environmental awareness as part of this scenario, and oftentimes when things like methyl B12 or other types of methyl supplements, there can be great improvements in an individual's ability to communicate, in their eye contact, in their awareness, etc. And so within the Autism Recovery System website is a complimentary copy of my book or ebook on methyl B12 therapy, which is not only useful for parents and caregivers, but practitioners as well, as a guidebook on how to implement methyl B12. So lab testing is available. In fact, we carry many of the labs from Great Plains Laboratory and other labs, including the organic acid test, which I mentioned here, through a website at labtestplus.com. You can go to labtestplus.com, look at the menu list of the different types of labs available. I'm Dr. Kurt Woeller for AutismRecoverySystem.com. Thank you.